Trump administration sending more signals today that it is optimistic that a coronavirus vaccine could be available to at least some Americans as early as November. This as some public health experts continue to warn that politics, and more specifically the looming presidential election, may be playing a role here. In a letter obtained by McClatchy, the CDC director pressed governors to eliminate hurdles for vaccine distribution. The letter reads, quote, CDC urgently requests your assistance in expediting applications for these distribution facilities, and if necessary, asks that you consider waiving requirements that would prevent these facilities from becoming fully operational by November 1st, 2020. Joining me now is Dr. Irwin Redlener, a pediatrics physician and a senior research scholar at Columbia University's Earth Institute. He's also the founding director of Columbia's National Center for Disaster Preparedness, with an expertise in pandemics. So, Doctor, thank you for joining us. Appreciate it. So this letter we're reading from here, it seems to be saying maybe some kind of vaccine is coming here in the relatively near future. States, be ready to have the facilities to get it out there right away if it is ready. What's your take on what you're hearing and seeing here? Is that a reasonable thing they're saying?
Yeah, hi, Steve. No, it's crazy and blatantly political move to get something going before the November election. And it's also extraordinarily reckless and dangerous. That means that we'd be pushing out a vaccine that's not been fully or even partially sufficiently tested. And clearly the goal is to try to get something going before the election. I'm just stunned, and nobody in my community of public health experts and scientists think this is remotely a good idea. We won't know by November 1st, or we won't even know by the first quarter of next year, whether a new vaccine is actually safe. A lot of the new vaccines are being developed with new technologies, and we have no idea whether they're going to be efficient and effective, no less safe. So it's really among the pantheon of irresponsibility and reckless things that the president has done since the beginning of this pandemic. This is going to rank right at the top if we start to see a push out of an untested vaccine, Steve.
So you're mentioning several months out into next year. Take us through how you're looking at the prospects for a vaccine right now, because I'm just looking at it. Looks like there are 3 here in the United States that are in this phase 3 portion right now. Pfizer, Moderna, I guess AstraZeneca, that's actually the one that teamed up with Oxford. They are all in phase 3. Is that right? How are you looking at the candidates for a vaccine right now and the prospects there?
Sure. Yeah, well, phase 3 takes a long time. That's when we go to large numbers of people being given the vaccine and waiting a sufficient amount of time to see if there's any late complications. We already have a huge problem in the country, Steve, with the anti-vax movement, people who are going to refuse to take the vaccine. We already have enormous numbers of people telling pollsters they simply won't take the vaccine. All we need now is a couple of really horrible mistakes or mishaps in the administration of a vaccine before it's ready. And that'll basically shut down our ability to convince the public that it's a good idea. So it's not prudent to rush this. It's not safe to rush this. And yes, we have a lot of things in the pipeline, at least 6 or 7 that we know of that are good, and probably a lot more than that if we're looking at this situation globally. So we have a lot to think about, a lot to worry about. And I think we need to make sure that the healthcare professionals, the FDA, the CDC, are not pushed into a decision that makes no sense and is dangerous by forces that are blatantly political, Steve.
We mentioned, too, the Labor Day holiday coming up here, another a long weekend at the end of the summer. Traditionally, obviously, a time Americans are out usually doing a lot of things. Anthony Fauci was on our air earlier today expressing some concern about that. Let's take a listen to what he had to say.
We're right around 40,000 new cases. That's an unacceptably high baseline. We've got to get it down. I'd like to see it 10,000 or less, hopefully less. I really want to use this opportunity almost to have a plea to the people in this country to realize that we really still need to get our arms around this. You can have an enjoyable weekend, but you can do a couple of fundamental things that we talk about all the time. Masks, distance, avoiding crowds.
What Dr. Fauci is saying there about his target getting it under 10,000 new cases a day, how realistic is that? What would that take?
Well, we'll take a lot of discipline to make sure that we have two, or actually three potential, outbreak time bombs. One is what's happening on the university campuses across the country, a serious series of outbreaks from coast to coast. The second thing is the Labor Day weekend, which is going to really get a lot of people going to parties and outdoor activities and things where they're crowding together, which is not safe. And third is this 55 million child experiment of really reopening the schools right now. All of those events, the university outbreaks, the school reopenings, and the Labor Day holiday are all potential places where we could see an outcome that results in a massive increase in the number of cases. I think Tony Fauci is absolutely right, and I'm hoping that the administration will listen to him and Dr. Birx and the other professionals, as opposed to being so influenced by what they're looking to accomplish before the election, Steve.
All right, Dr. Irwin Redletter, thank you for taking a few minutes. Really appreciate that.